It's been a while since we discussed COVID, but recently the CDC recommended that people over 6 months of age take the just released COVID-19 vaccine. Now, the boosters are covered by insurance, including private insurance, Medicare, and Medicaid plans, and are available at most local pharmacies. Plans are available for the uninsured as well. Now, we've made arrangements to have the COVID vaccine along with the flu vaccine available for our own employees at City Hall because keeping our workforce healthy is not only good for them and the wider community, but it's also good for business. So, should you get the COVID vaccine? I did. It was easy and my pharmacy had plenty of available appointment slots. You should consider getting your shot as well. Now, if you have any questions, ask your doctor or a doctor you trust. Now, you may have heard that Florida's current Surgeon General and Governor DeSantis recently announced that Florida would be the first state to recommend against taking the vaccine. I believe this was obviously more of a political announcement than a public health one, more likely intended to influence primary voters in Iowa than provide important health care advice to Floridians wondering what they should do. It's unfortunate that the issue of whether you should take a vaccine booster has become so politicized. Inserting politics into healthcare decisions can only lead to tragic outcomes. That's why I thought you could use another, less politicized viewpoint. So I reached out to Florida's former Surgeon General under Governor DeSantis, Dr. Scott Rivkees, now a professor of public health at the prestigious Brown University, to get his thoughts on the new vaccine. I always found Dr. Rivkees to be a straight shooter on public health issues, so let's hear what Dr. Rivkees has to say. Doctor, what is the state of play in Florida for COVID? How do you view the new COVID vaccine?
Yeah, first, Mayor, you've done a great job during this pandemic. I have to thank you for your leadership. It's been wonderful working with you over the past several years and glad to continue this conversation. So if you look at who is COVID affecting, first, COVID is still here now. Each week, about 4,000 people in Florida are being hospitalized with COVID, and we have 1,000 people who are dying. Going back to the beginning of this pandemic, about 25% of people who have died are less than 65 years of age. So severe COVID isn't just for individuals who are older. So the best way one can prevent against severe COVID, which means COVID which can result in hospitalization or death, is through vaccination. The other thing to think about, even though we talk about severe COVID, about 10% of people who have COVID will end up getting long COVID. And this also is something that's vaccine preventable.
Thanks, Doctor. Your successor came out against the vaccine. Who should people look to for guidance?
Yeah, so first of all, people really should look to who are the authoritative sources when it comes to drug and vaccine safety. We look to the FDA and CDC for guidance about antibiotics, for chemotherapy agents. It's the same process which applies for vaccination. And the CDC and the FDA have looked at this issue extensively, and they recommend that individuals 6 months of age and older receive the updated COVID vaccine.
Dr. Rivkees, given that this issue has become politicized, how does someone decide the wisest choice?
Well, look at the facts. A quarter of the people who've had COVID-19 and have sadly passed away are less than 65 years of age. I'm a pediatrician. There have been about 1,700 children who've died in the United States due to COVID, and more than half of those children don't have underlying medical conditions. So we vaccinate against flu, we vaccinate against other conditions, and COVID, takes its stand next to other vaccine preventable diseases. So get vaccinated.
Thank you, Doctor. We've been down this road before, when politicians turn healthcare decisions into political statements. In mid-2021, within months of Governor DeSantis' signing of executive orders and legislation that only sought to politicize vaccine usage, Florida's hospitals began filling up with, as expected, almost entirely unvaccinated sick residents. Just look at this 14-day snapshot of COVID daily hospital admissions in just Miami-Dade. The most sick were overwhelmingly unvaccinated, and there were real consequences. On a single day in August of 2021, 356 COVID deaths were reported in Florida alone. And the more our leaders treated the vaccine as a political statement, the more it got worse. Florida hospitalizations and deaths of mostly the unvaccinated were often leading the nation by very, very wide margins. And by the end of the year, Miami-Dade County was reporting close to 400 new patients each day being hospitalized. Did vaccine boosters matter? Astonishingly, only 4% of those requiring hospitalizations were people who had received their COVID booster shot. If you got your booster, you had very little chance of getting very sick. Yet our Tallahassee leaders were downplaying the vaccine to score political points. It should be obvious that whether and when you take this vaccine is a healthcare decision and should only be a healthcare decision and not a political statement to advance a campaign. If you are unsure or just have questions, listen to your doctor or a physician you trust. Listen to someone actually focused on what's best for you and your loved ones. Thanks for your attention. Stay safe.